Hello, my name is Dr. Lenore Powell. I'm with the Atlanta branch of Genova Diagnostics, a part of the medical education team. And for today, we're going to be discussing unlocking the mysteries of your body, the Organix Profile explained. So let's go ahead and just dive on in here. My goal for this presentation really is to discover and cover the who's, the what's, the when's, the why of organic acid testing or functional nutritional evaluation, as well as go over the 3 functional pillars, a part of our organic acids profile. So here's the big question: who can benefit? So you're looking at just various stages across life and various health conditions. So for example, those who have chronic health conditions, a lot of times they'll be taking different medications that might increase their demand for a certain nutrient because that medication negatively impacts that particular nutrient. But also there are chronic conditions like migraines or something like hypertension that can actually benefit from particular nutrients. So it helps us gain insight into how you're doing with that particular nutrient level. For women's health, especially those who are interested in fertility and conception, and even as we transition into menopause, our nutrient demands are a little bit different. And for males as well, especially this, we call it male pause or andropause, we sometimes will term it, but when males hit that around age 50, their nutrient demand, again, it's a little bit different. And so really trying to keep on top of what your nutrient demands are at that particular time of your life, it really helps us to understand that when we do nutrition testing. Pediatric considerations, those who have learning disabilities or who have developmental delays, or those who might just show consistent deficiencies in particular nutrients like iron or vitamin D or something like that. These are people that also could benefit from understanding their nutrient need by utilizing organic acid testing. Aging populations, again, aging populations, when you're older, especially for women, for example, your demand for iron is different. It goes down, right? So as we age, again, our nutrients and what we need during that time of our life, it is different. Athletes and active individuals, because they're cycling through their nutrients at such a high pace, their demand for nutrients, again, is going to be different. So their need for antioxidants will be higher. Their need for B vitamins will be higher. And I always like to tell athletic individuals, your performance is only as good as your ability to recover in between workouts and, those different times where we have to perform at high levels. So assisting in recovery strategies post-exertion, that's another reason why we might consider nutrition testing. And preventative health, those who just have a more proactive health mindset, who want to kind of avoid or decrease their risk for various diseases. Again, having optimal nutritional status can be very helpful in these cases. So what is the organic acid profile, or the OATS profile, which some people sometimes call it, but OATS is just organic acid testing. It's the same thing. So it's a functional nutritional assessment. So it's a little bit different than when you just measure something in blood, because when you measure something in blood, we're comparing you to people of like age and like gender, seeing if your amount is consistent with those individuals. But when we do your personal functional nutrition assessment, we're looking at your biochemical pathways to kind of see, do you have enough nutrients to run your specific pathways? And so that's how you can have somebody who has normal blood levels of a particular nutrient, but still has a physiologic demand for that specific nutrient. And this is why we call it more of an advanced test. It's because we're measuring those organic acids in urine. And it also helps to reflect, again, these metabolic processes and cellular health status. How are things going within the body? So the Organix Profile looks at about 70 different markers of metabolism. We're looking at central energy production. So that's like from your citric acid cycle, metabolization, or the ability to produce ATP. Detoxification markers. So do you have indicators that says that you're doing a bad job with detoxification, or do you have indicators that suggest you're doing a good job with detoxification? Neurotransmitter breakdowns. Remember, neurotransmitters, they're basically very important for mood health. It's kind of like this chemical signaling that happens within our body produced from our amino acids, but we do need specific nutrients to help with those various pathways. Oxalate production, so that's more looking at do you have a tendency toward making more oxalates, which could increase your risk for kidney stones, or do you have an imbalance in the glyoxal pathway, which could indicate the need for certain nutrients to help it work more optimally. And then oxidative stress, which is usually I have more antioxidants versus antioxidants. So it's basically this imbalance in your body's ability to manage those things, which can come from a variety of causes. For the clinical utility, so now it tells us your personalized recommendations based on the results of the test for various vitamins as well as minerals. And that's really helpful because, again, it's going to be super tailored to that patient and what they have going on, regardless of their life stage. It helps us to really pinpoint sometimes even the root cause of complex symptoms. So sometimes people might say, I'm so tired, I'm fatigued, and I don't know what's going on, but it can actually be rooted in nutrient insufficiencies. So it can actually help pinpoint the root cause, especially if it's not your standard thyroid or being anemic. It can show us some other reasons that somebody might experience fatigue. It also helps to support refined dietary and supplementation recommendations. So if you have a patient already on a supplement regimen, you can actually perform the test while they're on that regimen to see where do I need to further tweak the actual protocol for that patient. But if you want to get more baseline information about that patient's nutrition status, you can always have them stop their supplements for about 4 days prior to the test, and then you'll get some information about the water-soluble nutrients their baseline need. So let's just go a little bit more into just kind of visualizing what's happening on the organic acid level. So we have this basic pathway. A converts to B, converts to C. E stands for enzyme. We have 1 and 2. And this little starburst you see with next to E2 or enzyme number 2, it represents the cofactors, which are vitamin and minerals needed for that enzyme to work efficiently. And so if we have an issue with this enzyme, meaning we don't have enough vitamins or minerals, what's going to happen is we're going to start to detect in urine high amounts of B because there's like a blockage, a block up of that pathway. And so we can detect those blockages or block ups or insufficiencies or hiccups in the biochemical pathways by looking at urine. And so let's just use the example of methylmalonic acid here. And so you can see here that methylmalonyl-CoA, if we don't have enough B12, if there is not enough cofactors to produce or push that particular pathway forward, it'll be redirected into methylmalonic acid. That's why MMA or methylmalonic acid is an indication for needing B12. It's because basically we need to make sure we have enough B12 to move it down into the succinyl-CoA pathway, which eventually can feed also into the citric acid cycle. So when to test? So I basically say if you're breathing and eating food, you need a nutrition test. There's been so many times that I've reviewed the profiles and we thought the patient was healthy. We thought the patient had a really great diet, but we've discovered significant nutrient deficiencies and we were able to get down to the root cause of that. So just because you're eating a healthy diet does not necessarily equate out to having great nutrition. There are many different steps in between you eating something and your body actually enjoying those nutrients. So in terms of clinical conditions, the most common reasons people order this test are really going to be, number 1, fatigue, either a new onset chronic fatigue that we just can't explain or something just abnormal. Number 2 is going to be your patients who are experiencing mood challenges, whether depression, anxiety, schizophrenia, whatever. Because when it comes to mood, again, if you don't have the adequate cofactors for the neurotransmitters to work well, then you can have mood challenges. And lastly, our optimizers, people who are interested in optimizing their health for a particular performance, or they're interested in optimizing their health for a new stage in life, or whatever it might be. But let's look at this right-hand column, because I think it's really worthwhile noting these nutrient depletions and other reasons you can have insufficiencies. So number one is going to be medications. A lot of your medications deplete nutrients. So we know about CoQ10 being depleted by using a statin drug, a beta blocker, or diabetes medications. Likewise, with your hormone medications, it can deplete B vitamins and minerals as well. So metformin can deplete like your B vitamins, especially B12. So knowing the patient's medication list and doing a quick research to see how it might impact the nutrient status, that's really helpful. And this test can really help guide you in terms of they need this much, or however we need to kind of adjust things. Special diets, there is a right way and a wrong way to do every single diet. So if you are doing let's just say a vegetarian diet, but you're eating cheese pizza, Doritos, and drinking soda all day, that is the wrong way to do that diet, right? It's not nutrient dense. And so therefore we can evaluate how patients are doing on those particular diets and maybe explain why they might be experiencing some different symptoms. Then GI surgeries, according to the American Gastroenterology Associations, they say that if there's some kind of a GI-related surgery, especially a bypass surgery, then you should have nutrition testing done every single year to kind of check in on your status and see where you're at. Now, there are two different types of gastric procedures. You have the restrictive one, which is where you use like the lap band or they staple the stomach smaller. And then you have the malabsorption one, where they basically take the stomach and attach it to a latter part of your small bowel. So you're bypassing a part of the small intestines, which is really important for absorption. So these are other individuals who might really benefit from regular nutrition testing. Usually every year is on average what I see clinicians repeating this test, but sometimes we repeat it sooner based on what the patient has going on. So why choose Organix? So we can really find those like nuances in metabolic function that are not visible in a standard test. So in a standard test, you might have normal magnesium, again, compared to people of like age and gender. But when we look at your biochemistry, it might say, no, you actually need a little bit more magnesium. That might be why you're constipated. That might be why you have headaches. That might be why you have muscle cramps. So it really detects those small nuances in metabolic function that we might not be able to see on standard testing. Clinical relevance, so it really helps unveil, it helps illuminate these various nutrient insufficiencies that can impact your patient's health, and it can also help us identify early metabolic disturbances. And so when you look at the citric acid cycle, which is basically our way of taking our macronutrients and generating energy or metabolization, ATP, if you see a lot of issues with that citric acid cycle, one of the problems might actually be metabolic health. You might have an insulin glucose issue, right? So it can help us identify earlier stages of those metabolic disturbances prior to what a standard blood test might show us. Actionable data. So we give you recommendations for antioxidants, for B vitamins, for minerals, for GI support. So you can actually make action based on the results we give you. And again, a nice baseline for tracking treatment efficiency. So if you're following up with the patient's health every year, you're doing another screen, or if you're testing them sooner to see how they're doing on your regimen, you can really check to see the efficiency of that treatment and track it just using the tests and seeing if the recommendations change or not. Enhanced patient outcomes and compliance. So one of the biggest issues a lot of clinicians deal with is compliance. Sometimes patients are data driven. They need to see, why are you telling me to take this nutrient or this supplement? And they need to see upon follow-up testing improvements. That a lot of times will help with compliance and can really allow you to personalize your patient's treatment protocol, because we know that everybody's depression or muscle cramps is not rooted in the same issues. Sometimes it's a little bit different than Mary, Joe, Sue, or Sally, right? So it really helps us with that personalized touch. So beyond traditional testing, so again, I'm going to be, listing a few things that we discussed already, but, traditional testing focuses on disease. You don't have enough vitamin C, you can get scurvy, right? But we're not looking for, diseases due to deficiencies in nutrients. We're looking for subtle imbalances that can contribute to why you feel the way you feel. So unique insights from organics or organic acid testing, which we sometimes call OATs. So again, looking at those metabolic byproducts for that deeper health analysis, it allows us to have more of a proactive health management stance versus being reactive to health issues. And then synergy with standard practices. So let's say you have a patient who's on, who has diabetes and they're on metformin or something like that, right? Well, in terms of management tools, you're using medications to help that patient manage their glucose. But we know that, metformin, it can deplete your B vitamins. So we might also experience with metformin some GI disturbances. So this is just done in synergy with standard practices. This does not replace your standard testing. This is done in addition to really help optimize how people respond to medications or various treatment protocols or how their disease process is progressing. So here, in terms of personalized treatments, again, you do receive recommendations for antioxidants, B vitamins, minerals, and GI support. And what's really cool is that we provide these suggested recommendations here, and it's based on the results of the test. And then the provider recommendations allows you as the clinician to further tailor the recommendations. So let's say, for example, you have a patient who has a homocysteine of 28, which is an elevated homocysteine level that can be a risk factor for cardio health. Well, we want to bring down that homocysteine level by providing methyl groups. And so we would say, well, instead of just giving regular B9, we need to make sure it's in the methylated form. Instead of giving regular B12, we need to make sure it's in the methylated form. And we might need to increase the doses based on that patient's really high homocysteine level. Also on the profile, we go into these functional pillars, which is a kind of a built-in scoring system for the profile, looking at areas of mitochondrial dysfunction, toxic exposure, as well as methylation imbalance. And you can see the score 0 to 4, minimal need for support, 5 to 7, moderate need for support, and 8 to 10 is a high need for support. So let's actually go into more detail as it relates to each of the individual pillars that we are looking at here on this profile. So for the first pillar, mitochondrial dysfunction, it's your body's ability to metabolize or basically take the macronutrients, your fats, your carbs, your proteins, and create ATP or energy from them. And so when we have mitochondrial dysfunction, it could be an issue as it relates to not having adequate nutrients like vitamins and minerals to help move the various pathways forward. It could also be the exposure of toxins that can slow down a particular step. I think about things like aluminum, magnesium, arsenic, antimony, lead. They can actually negatively impact how your citric acid cycle moves forward, which will negatively impact your ability to produce ATP or energy. And then genetic polymorphism. So do you have a particular SNP or genetic wise, does a specific enzyme in your body not operate like we would expect it to? What's not listed here, but we should also consider, are drugs, medications. So some of your medications, let's just pick a statin, for example, will block certain pathways, which also are important for CoQ10, but it can block those pathways because we're trying to lead to lower cholesterol levels. So again, medications, I think, is something else that we should definitely add to this list. And then for mitochondrial dysfunction, like what diseases are associated with it, look at this list, right? Neurocognitive disease, diabetes, cancer, mood disorders, cardiovascular disease, and even chronic fatigue syndrome. So when we look at this first pillar, mitochondrial dysfunction, some of the cofactors that it might lead to are things like your B1, 2, 3, 5 alpha lipoic acid, magnesium, manganese, but it can also make us think about things like CoQ10 and carnitine as well. And as I mentioned earlier, is there any toxic exposures? Is there a medication impact? And genetic wise, are there any SNPs? For the toxic exposure pillar, these urinary markers reflect exposure to some kind of environmental component, and it can cause our detoxification pathways to be challenged a little bit more. And so when we see elevated toxic exposure markers, first we want to figure out where is it coming from, like what's our source of exposure, so we can create a plan to get rid of it or to eliminate those exposure sources or at least reduce it, right? But also we want to consider getting the toxic thing out of our body. So antioxidants, regular nutrition support for supporting those detox pathways are important. Having regular bowel movements, sweating, urinating and hydrating very well. These are all things that we consider when there are signs of toxic exposure. And lastly, for the methylation and balance pillar. So this is just a general picture of methylation that you see right here on the right-hand side. But methylation is just a really small molecule, a carbon attached to 3 hydrogens. And it occurs billions of times per second throughout the various cells in the body. And what's really crazy is it impacts things like your cardiovascular status, your neurotransmitters, your detoxification abilities, like your DNA. It impacts so many things, this really small molecule. And if we don't have adequate nutrients, like we think about B9 or folate and B12 for methylation a lot, but you also need B2 and B3, and you need B6 and magnesium and zinc and adequate iron. So if we're insufficient in any of those nutrients, that our ability to methylate will be impacted. Now, you also need certain amino acids like methionine and glycine. Although not measured on the organic acid test, you can upgrade that test to get a metabolomics plus profile, where you get not only the organic acids, but you also will get the amino acids as well. But with the organic acids test, we still get insight into those various B vitamins and mineral cofactors for methylation. And then methylation imbalance is associated with a lot of the similar diseases that we saw associated with mitochondrial dysfunction. But here's some additional ones like neurodegenerative, diabetes, cancer, cardio, neuropsychiatric or mood disorders, liver inflammatory diseases, as well as obesity. And so we already reviewed some of those cofactors needed for methylation support, talked about the amino acids, the B vitamins, as well as the minerals. So that's the end of our little talk for today. Just really, again, kind of going over the who, the why, the what, the when of organic acid testing, and talking about those 3 pillars: mitochondria, toxic exposure, as well as methylation and balance. For further information, we do have an organic acid support guide you can access on our website, gdx.net. We also have the lab report podcast available. Doctors Patty and Mike Goldevers, they do a very great job, and as it relates to kind of going over various things as it relates to functional medicine. They also have a few episodes on there about organic acid testing as well. But thanks for spending a little bit of time with me. I hope you guys have a wonderful day. Bye.